Hello, I'm Dr. Chris Carter, and I want to talk to you right now about your hypothyroid condition. We have come in contact with one another. Either you have heard about our office or seen some of our advertisements, or you have a family or friend who has had hypothyroid problems that has made a wonderful turnaround with what we do here in our office that's different than maybe what you've had in the past. Now, I want to explain a little bit about that to you. What we do that separates us and makes us different is this. We just do expanded testing. That is the biggest thing that really gets us the results you want and you need. And let me explain to you what I mean by expanded testing. All of us have been to the doctor at some point in time and have had our blood drawn. The physician, whether it be a chiropractor or a medical doctor or naturopath, they will look at specific things on your blood panel. Now, with blood panels, you can order a very narrow range to really kind of target a very specific system you're looking for, or you can order expanded ranges, okay? Now, a narrow range is okay if someone comes into the office and they have a cold or a cough or something that's going to be a pretty simple fix. You don't need a whole lot of additional information. If you suffer with a chronic health condition such as hypothyroid problems or fibromyalgia, you need an expanded clinical profile on your blood work, because there are many, many things that your blood work will tell us that is going right with you and wrong with you. And until we do the proper testing, you may never know the core issue behind why you feel the way you do. For instance, if you have hypothyroid problems right now, or a family member or loved one does, you've probably been through the mill with standard thyroid panel testing. TSH, T4, maybe T3. They come back, they're either in range or not. They give you medication to keep you in range and say, hey, your lab tests look normal. Don't know why you feel the way you feel. Let's give you an antidepressant and let's give you some other medication like Lyrica or Cymbalta that may help you with some other symptoms. Well, for some people that may be okay. If you take the medicines and you feel fantastic, it takes away the symptoms that you have. It's probably what you need to be doing. But if you've been on the medication for a while and you just don't feel like it's done a whole lot for you, okay, it's not necessarily the medication's fault. It's just that you've had someone target a symptom that is not really caused by the real problem, okay? For instance, if we look at hypothyroid conditions, you are going to fall into one of two areas. Either you truly have a thyroid problem that's bad, and your thyroid needs additional TSH to stimulate it to produce T4, okay? That's one way. Another way, which 80% of the folks in the United States fall under this way, and if you're watching this video, 80% of you are going to have this. It's an autoimmune disease that's affecting your thyroid, okay? Now, I want to keep this video brief, but I want you to learn and understand what we do that makes us different. You've got to have the testing to see if you fall into this 80% group, okay? Hypothyroidism has almost become an epidemic in the United States. And the problem is this, it's not being addressed correctly. There are tests that need to be done for you, tests that I can order, which I've done numerous times with folks that will truly tell us, aha, this is the reason why you feel the way you feel. It's not that your thyroid's not working right. It's that you have an autoimmune attack against your thyroid, okay? That is what we need to find out. Or the conversion factor of T4 to T3 is not working right. That takes place in the liver and in the gut, all right? If you've not had a complete, very complex examination and laboratory panel done, then maybe somebody's missed the boat, okay? If you're still feeling bad. That is what we do here. We want to find out exactly what's going on with you and then give you the tools necessary to make the improvements. But you've got to know what's going on first. You've got to get down to the core issue and go, okay, this is it. This is what we prioritize. This is what we get better, okay? And that's what we offer you here. One last thing before I go. I want you to do this. Do yourself a favor. Go to your Google browser and I want you to type in the #1 cause of hypothyroidism in the United States. Just type that right in your Google browser. Type in #1 cause of hypothyroidism in the U.S. And here's what you're going to find out. What's going to pop up is going to be a full listing, a full page of a condition called Hashimoto's autoimmune thyroiditis. It's a big word, okay? But folks, that's the biggest reason why people have hypothyroid problems. It's an autoimmune attack. Find that out. Go to my website, LouisvilleThyroid.com. Type it in, LouisvilleThyroid.com, and you're going to see what makes us different, because we don't miss ordering the test that causes the most complaints with hypothyroid problems, okay? That's what I want you to learn today. Do those two things. Go to Google, type in #1 cause of hypothyroidism in the U.S., go to my website, LouisvilleThyroid.com, and you're going to put these two together and go, I think this guy knows what he's talking about. Thanks for listening. We'll keep in contact real soon. Have a fantastic day.